All I remember is them roll me in and him shaking me in the ICU for consent to intubate. And I remember nothing else.
He was really sick. It was really scary. And I remember thinking, they're gonna have to drag me out of here. How do you leave?
We knew that he was going to die within hours if we didn't throw everything at him.
Well, I was born in Alexandria, Virginia, the outskirts of Washington, D.C. Went into the military, and I served as an Army Ranger. And when I was serving as an Army Ranger, that's when I met my wife. She was 18, and I was 20.
I had a F-16 pilot following me around this military party, and Bill kind of came and rescued me from this kind of creepy older guy that was following me around.
We celebrated our anniversary this month, so it was our 29th year anniversary. But we dated 9 years prior, so we've been together a total of 38 years.
And I went to med school, and then he decided to go to med school.
After I finished medical school, she did her pediatric residency here at LSU, and I did an internship year, and then we moved to Philadelphia. Being two physicians, it was quite difficult having really no close family. You know, things worked out, and we moved down to Shreveport, and that was in June of 2001, and we've been here ever since.
In February was when we first started seeing cases in Louisiana. I had been dealing with all of those first cases in our area, seeing every death come across my desk. They all had to be reviewed, and so I knew how bad COVID was. He always had I don't know if he had some sort of belief that he was at risk for COVID, but he, from the very minute we started hearing more about COVID and people started seeing COVID in Louisiana, he locked down his office before anyone else.
I instituted things there just to protect my staff and patients. We were cleaning every doorknob, okay? Mandatory mask wearing, eye protection, everything. We're doing it well before it was. We're talking this February, March, we're doing this. I woke up and I told my wife I wasn't feeling quite well. Something, and I couldn't, as a physician, I'm running through my head what's going on.
I kept asking him, I said, people are getting really short of breath and dying really quickly, so you have to tell me if you get short of breath.
She came to check on me, and I was gray.
By the time we got him to the ER, his pulse ox was in the 70s. And I told him as he was getting out of the car, they're going to intubate you, and that's okay. They're going to take good care of you. You let them do that. And he said, okay.
All I remember is them roll me in and him shaking me in the ICU for consent to intubate. And I remember nothing else.
It was very scary because I knew how sick he was, but you have no idea what to do.
The thing with when COVID-19 struck, most people felt it was just a variant of the common cold. It's no worse than the flu. And we rapidly learned that that wasn't true.
You have to remember, this is very, very early into this. So we really had no idea how to treat people with this disease.
So that was kind of going through my mind. Certainly was probably gonna have to take care of this person tomorrow, and how do you not get it? How do you not catch it yourself? The first things first, they always said, in the middle of a pandemic, there is no such thing as emergency. So it was, taking the time to make sure we had all of our protective equipment on and that sort of thing before we went into the room, understanding that, yes, that lost time could cost the patient their life, but at the same time, we wanted to make sure and keep all of us protected because we had, a lot of other patients to take care of. Once put all the stuff on and just had to trust that it was going to be enough.
I was just shocked because not an hour before I was told he's doing better, and now I'm told he's dying.
Bill was definitely in the first wave of critically ill COVID-19 patients. We had multiple patients at that point in time when Bill had presented. So we had some experience.
We knew that he was going to die within hours if we didn't throw everything at him. Fortunately, because we are an academic medical center, we had all of that here. We were already experimenting with it. We were already doing this trial or another trial. We had all the equipment, all the expertise, everything, and we could get it to him within hours. His carbon dioxide was 127. Normal is 35, 40. And that's lethal to most people. We also knew his inflammatory response was so exaggerated that there's no way he's going to live till morning.
His main problem was his lungs. They just weren't working very well. He was very hypoxic. He was on high FO2 on the vent. He was on high vent pressures as well. For several weeks, it was just a matter of continuing to support him, continuing to support his lungs, and ultimately just giving time for things to heal. He was kind of to the point where we were doing everything we could do with a ventilator, and he was approaching the point where if we continued to increase settings, we were going to end up doing more harm than good.
Well, our choice at that point was do we do ECMO, extracorporeal membrane oxygenation, or do we do ECOR, which is mostly for CO2 removal. And since Bill's main problem was his excess CO2 production and inability for him to ventilate and the ventilator to help clear that CO2, we felt that doing ECOR first would be the better process.
He was also one of the first, if not the first patient in the Shreveport-Bossier area to get convalescent plasma, which is plasma, fresh frozen plasma that has specifically come from a donor who has already had and recovered from COVID, with the theory that they've got antibodies to the virus in their plasma that could potentially help somebody that's currently got COVID help try and fight off the virus itself.
Not only did we put him on the machine that removes carbon dioxide extracorporeally, which means we just draw his blood out of his system and remove the CO2 and don't beat him up with the ventilator. But we also did plasma exchange. He got convalescent plasma. He got all of it, only because at the time we didn't know what else to do. You could see within 24 hours, he wasn't over, by any means out of the woods, but you could see he stabilized.
He was really sick. It was really scary. And I remember thinking, they're gonna have to drag me out of here. How do you leave?
His trajectory was such a roller coaster. I've actually never seen anything like it. He would respond one day, the next day, I thought I was going to have that phone call with Martha. And the next day he would look better. The next day, I'm like, oh my gosh, I'm going to have to, say some really bad news. The next day he'd look a little better. Then suddenly the betters, started to improve, but you're talking over a month.
He's had this endotracheal tube in for a couple of months plus. And prior to COVID, at 2 weeks, we would make sure that if somebody wasn't coming off the ventilator, then we would go ahead and do a trach. So here we were, 4 times that amount of time. At this point, he needs rehab. I mean, he's been laying in a bed for 2 months.
Golly was in my med school class. I've known him forever. He said he needs a trach. And I said, I know, but he's still COVID positive. He's like, I'm going to trach him tomorrow. And I said, but he's still COVID positive. He's like, I'm going to trach him tomorrow.
Dr. Ghali came up with 2 other faculty members in oral surgery to do the trach. The 3 of them did, and of course it went flawlessly and no issues with it whatsoever. And Bill actually kind of started waking up and becoming a lot more interactive.
So I was in ICU, and the whole front of the wall is glass, so the nurse can see it, obviously. But I could see my reflection, and I had a full beard, but I couldn't move. My legs were completely flaccid. Couldn't move my arms. I could move my right arm, and I was trying to get up to touch my face, and my nails were long. The nurse jumped up and almost fell to the floor. I could see tears running down her eyes.
You're just overwhelmed. It's overwhelming. You're just joyful and happy for my children.
And then my wife came in. She was hopeful and scared of would I recognize her, what was going to be my cognitive ability. And she was very calm, and I could see it in her eyes. She was trying to be strong. And she asked me, "Do you want to know how long you've been here?" And because I looked around the room, and there was no date. And then she told me, and then I'll be honest with you, it didn't really sink in. It took a couple days.
He was not going to sit in that bed. He was going to rehab. Now, he trained in physiatry, physical medicine rehab, and he knows how weak he was. And as soon as he came off that ventilator, he was trying to do physical therapy.
And I got dressed every morning, waiting for to do something, even though I couldn't move. They made arrangements to bring a physical therapist in, an occupational therapist who felt comfortable being in that thing, and they worked with me tremendously. They work with me every day, and I think they're a little worried that I was going to push too hard. If you don't fight the good fight, you lose it. That's as simple as that. And I tell every patient that, and now I am having to live that. So I was released from the hospital May 17th.
It was amazing. I really never thought I'd see it. I saw him get better and better and better, and then to come back and see him getting in a wheelchair, going out to his car. Hard to make an old man like me cry, but it was pretty tearful.
I knew without a doubt that we wanted Suzanne Tinsley and Maria to do his rehab.
So when he came in, he was in a wheelchair, and so we started talking about what he'd been doing since he'd been released. And so he said, well, at home, I walk a little bit, but I use a walker because I feel very unsteady on my feet. But mostly if it's going to be anything longer than 30 or 40 feet, I'm going to be in my wheelchair.
What was really interesting when he came in for that first time, and we said, okay, what are your complaints? He started listing, well, I have proximal weakness. I can't pick up my left foot. I've got some peroneal problems. My left shoulder, I don't know if I have a scapular nerve issue or if it's just weakness. So that was kind of unique to interact with him in that way, because basically he did his own differential diagnosis. We got him in our vector system, which is a system that can de-weight him, and so that his joints and his muscles and his body isn't accepting all of his weight, and that we could practice on walking and doing squats and trying to develop some functional strengthening, but also protect him at the same time. You could tell he was so driven. He wanted to get back. Just his attitude was, I've been spared in this life and I want to get back and make a difference. And so what was difficult was trying to rein him in a little bit, again saying, okay, Dr. Whyte, we'll get you there, I promise, but let's not try to do it in a day.
The last day that he came, he was running around the track, not walking. And then when he came to us the day before discharge, he told us he had run for 2 hours on his treadmill at home. And the fact that he could do that was remarkable. It just showed that he was basically almost back, because he was doing 3 hours before, but he was back where he needed to be.
Now I had a goal. It was unrealistic, that I wanted to be back seeing patients in some form by June 1st. Well, it took me to about June 21st, and I was able to work half days, and by August, I was back doing some of the basic procedures that I do. But it took probably until November to where I felt I had enough stamina to work a normal day.
He survived because of the care he was able to get at LSU.
One of the best things that Dr. Whyte brought to our unit was this sense that, okay, we're kind of on the right track for a few things. We got to weed through what worked, what didn't work. But we knew that what we were doing was right on. We were able to share a lot of knowledge. We have grown from that. A lot of patients have gone on extracorporeal support, which is pulling blood out and oxygenating and putting it back in. And now what was experimental has now become mainstream.
I don't think people realize how amazing that building is, the people who staff in there is, all the equipment that they have, everything that they bring to the table is just top notch. When he needed that extra high level of care, I was just so grateful that LSU was there to give it to him.
If I had a professor in med school, he always said that you'll never understand a disease as well as a patient who suffers it as a physician. And he couldn't be more right. But it's given me a more realistic expectation and perspective of what do they go through on a daily basis when they suffer things. If I didn't give it my 100% effort, I feel that I was failing those who saved me. I owed them to do my best because they did their best.
Yeah, they saved his life, and we're just forever indebted to them. I loved him before this happened, and it's just grown beyond measure.